Many men are embarrassed to talk about it, but that dribbling after urination is much more common than you think. It has happened to me, and I know it probably happens to most men. And it's not a lack of hygiene, it's something much more common than we think. In some people, we might think it's a disease. In some cases, it might be. In others, we might think that the smell of urine we sense is fertility, but the reality is that there is something behind it that needs to be addressed. What are the causes of post-micturition dribble, the dribble after urination in men, in your man, or in your body, and how can you solve it? The male urethra is much longer than that of the female, and therefore it can lead to many other problems, more complications than the female sex. It is something that is quite common. Post-micturition dribble in men can be something that is not uncommon, meaning that a male person starting from the age of 30 begins to experience it. But this indicates that there is an underlying health condition, perhaps a prostate issue, a bulbar urethra, the lack of nerve impulse, fluid retention in the bladder, neuropathy damage where the brain does not give the complete order to the bladder or the reproductive system to release everything at the appropriate time when it should be eliminated. But how is this problem solved? Which is the most important thing. And why are you seeing urinary dribbling, bad odor, poor hygiene? Some people will say it smells like fertility, but in reality, it is a health problem that needs to be solved. But first, I ask you to subscribe to the channel, hit that bell, and get notified of any new video I might publish, often with some advice I might give. This little advice and this little video can change or save your life. Number 1, urine retained in a bulbar urethra. A bulb is more or less like a balloon, a place where urine can accumulate inside the urethra. Now the urethra, as I mentioned at the beginning of the video, is much longer in men than in women, and therefore, and because of the shape of the urethra, because of the shape of the male penis, in fact, we can accumulate certain streams of urine in some part of that urethra, and when we finish urinating, we don't realize it. We lift the member, shake it all around, which can be something very common for men to do, and literally, after we start moving, start having our normal daily activity, some urine comes out that we hadn't realized should have been out before pulling up our pants. Now, if you are one of those people who constantly see that post-urination dribble after urinating, it is very important that you milk yourself, so to speak, in a gentle or polite way so that urine does not remain retained. In fact, if you are someone who does not clean, because you can clean with a small piece of toilet paper so that absolutely nothing remains on the male member, it tends to accumulate bad odor, bacteria, and sometimes even unpleasant smells, which one might say is fertility, but in reality, it is a lack of hygiene due to a practice that has not yet been implemented. If you want something natural that can help improve the function of your male member so it rises as it should, so you can urinate as you should, to release everything accumulated and not due to inflammation or any other cause, look for the virilitize, the prostatine, the Kirkjewel, and the bear brain from Finland at finlandvitamins.com. Number 2, your prostate may be enlarged. The prostate is a small gland the size of a walnut, and our urethra passes through it. When our prostate is inflamed, swollen, the urethra inside gets squeezed and logically retains the urine and does not let it out. If your prostate is enlarged, you have prostatitis. Be careful, because if you don't treat this, it can lead to cancer. Now, if you are one of those people who see post-urination dribbling, meaning after urinating you are still dripping or have difficulty starting to urinate, you have to push or stand there for 5 minutes for the urine to finish coming out, it is very likely that your prostate is enlarged and you need to reduce the inflammation to prevent a problem later on or in the future. Logically, it's a man's problem. It should be solved. If you don't treat it, be careful. Later on, it can give you much to think about and much to cry about. Look for something like prostatine, Kirkjuhel, D-berry, metathyroid, or Kirkjuhel that can help you in a package to reduce prostate inflammation, restore your hormones, improve your masculinity, and much, much more. Number 3, pelvic floor weakness. The pelvic floor is extremely important for both men and women. In women, it helps in childbirth, helps with urination. In men, it does exactly the same. It helps to eliminate all the liquid retained in the urethra. And if you have a pelvic floor that has no strength or does not contract, the bladder does not contract the lower abdominal muscles, then logically you will retain urine simply because you are not exercising, you are not doing any physical activity, or also simply due to age and wear, your bladder, your pelvic floor muscles are becoming increasingly weakened and need to be strengthened. For this, I suggest that you do Kegel exercises for men, which involve contracting and relaxing the pelvic muscles several times a day. Lift your legs, open them, close them, sit down, stand up. This type of exercise during training is very important and literally also gives you a masculine strength that, believe it or not, can help you a lot with pelvic health. The health of your internal organs, because they need muscles to function, something like the bird brain and the neuromatrix will help you achieve that muscle control. It's important to keep in mind that our muscles are controlled by our nerves, and if our nerves are damaged, then logically the pelvic floor won't be able to function. Number 4, nervous alterations or nerve damage. Everything our body does is commanded by our brain, and as the years go by, as the decades pass, our nerves wear out, meaning the function or the orders that our brain gives to our bladder or our male organs deteriorate. That deterioration can come from a disease such as diabetes, which causes poor circulation to the nerves, causes neuropathy. It can come from multiple sclerosis. It can come from lack of youth, that is from age, from simple wear and tear, or it can even be other slightly more complicated diseases, like spinal cord injuries that can affect the control of our bladder emptying, or simply the simple wear and tear that occurs over the years. If you are one of those people who feel that maybe your body is not responding well, or you have neurological damage because you don't sleep or have high sugar or some cholesterol problem, fix this problem, address it, exercise, change your diet, make sure your thyroid is activated, and all this can return to normal. Look for something like metaglucose, neuromatrix, magnesite, metathyroid, apalizer. All of this will make your body function, get back up, and all processes, not just your bladder, can be activated. A like for the video. Much love.